Complete Health Dentistry.
Good morning and welcome to Complete Health with Dr. Mike Rogers. I'm April, your host. We have so much to talk about today. It was a big week for our Complete Health butterfly and her transformation. We'll talk to Dr. Charles Whitney, our medical advisor, later in the show about his findings. Before we discuss the butterfly, I know, Doctor, that you spoke with Dr. Reynolds of Northeastern Gastroenterology Associates this week about colorectal cancer, since this month is Colorectal Awareness Month. Colorectal cancer is the second leading cause for cancer deaths in the U.S., which makes it a very important topic to discuss with our listeners. Good morning, Dr. Rogers.
Good morning, April.
What are the causes of colorectal cancer?
Well, according to Dr. Reynolds, no one really knows what actually causes or predisposes a person to colorectal cancer. They do believe that there's genetic predisposition to this, like in many other illnesses, and then also environmental response or exposure can create this issue. The main thing is it's really not known. One of the big things that they do know is tobacco use increases the likelihood of colorectal cancer. The other things that play a part are red meats, a low vitamin D value or level, and obesity, along with the bacteria in our mouth called Fusobacterium nucleatum.
Do only people who have a family history of colorectal cancer need to be concerned?
No. Dr. Reynolds says he diagnoses new families with colon cancer continuously. The incidence of spontaneous colorectal cancer in new families is significant in our area. In fact, age doesn't even play a part because he's had a patient as young as 23 with colorectal cancer, and that's why he stresses screening early and check out as much as you can to evaluate for this. There's a test out there called Cologuard that can be done at home as a screening test, but the gold standard is a colonoscopy.
Are there signs and symptoms that people should watch out for?
Yes. Well, the most important thing to remember is that the most common symptom of colorectal cancer is there is no symptom.
That's frightening.
It is. And he emphasizes that a person experiencing symptoms of irregular bowel movements or a change in consistency or color of the BM or a change if there's blood in the stool, any unexplained weight loss, these are high-risk symptoms that should be evaluated by your physician immediately.
When should someone get evaluated?
Currently, the recommendation for colorectal screening is all males and females alike, starting at the age of 50. However, for African Americans, the risk of earlier occurrence is so high that he recommends starting at age 45. The other thing is, for a patient with a family history of colorectal cancer or polyps, he recommends starting them 10 years younger than that previous age, so at the age of 40.
So I've heard you talk to patients in our office about colorectal cancer. Is there a connection between oral health and colorectal cancer?
Yes. Fusobacterium nucleatum is one of the key pathogens which plays a role in oral plaque formation due to its adhesive ability, and it serves as a bridge organism during colonization of biofilm, meaning the glue or the plaque that's in our mouth. And it's one of the biggest anaerobic bacteria that we have. We used to just look at it as it's part of our normal bacteria in our mouth, and it did contribute to periodontal or gum disease. But now we're finding out through a lot of medical studies that this pathogenic bacteria, or this really bad bacteria, contributes to all kinds of other things, like we're finding out with other bacteria in our mouth.
Can you tell me where we would find these medical studies?
In recent studies, as early as, say, last year, December of last year, in the World Journal of Gastroenterology, has literature just expounding on the relationship between the oral relationship of this bacteria and colorectal cancer itself.
What are the developmental stages of colorectal cancer?
Well, colorectal cancer develops in 5 stages. It starts as a polyp. It goes to an early adenoma, and Fusobacterium has been found and proven that it can contribute to the formation of adenomas. It then goes to late adenoma, carcinoma, and then invasion of the tissue. Fusobacterium was found to be importantly associated with its development and enhancing factors, changing the inflammatory state or the irritated state of the polyps to a malignant state of it. And so it also changes the microenvironment or the environment right there in the colon around those polyps. So it predisposes us to not only irritation of the area, but inflammation leading to cancer.
How does someone know they have this bacteria?
In our office, we can actually test specifically for this bacteria.
How?
It's a simple test, and we can get the results back in as quickly as 2 weeks. We do a saliva test.
Are there dental treatments to address this bacteria if you have it?
Yes, none of which are surgery.
Are there dental treatments to address this bacteria?
Yes, and none of which are surgery. We go in, we irrigate the areas where these bacteria are. We teach you how to address it and take care of it. We help you manage this bacteria to keep it as minimal as possible. Just being on an antibiotic, some patients will ask, can I just go on an antibiotic to cure it? And no, you really can't, because it's there and it's always going to be there once you have it. It's just a matter of how can we control it to the point where it doesn't create other issues.
So what you're saying is this is a partnership between our office and home care with the patient.
Correct.
And
a combination of lifestyle change, because it's from here on out that you really need to be meticulous with your home care.
okay, so I know many people probably have the same question as I'm going to ask. Doesn't a regular cleaning treat this?
No, it doesn't, because a regular cleaning is just going to clean above the gum lines. In some instances, it may go below the gum lines, but it's not removing the bacteria, because these bacteria are sitting way down deep in the below the gum line, and they actually get absorbed into the soft tissue of the gums. And even if you don't have teeth, it can be in the soft tissue in your mouth. So you have to address it more than just a cleaning.
Okay, thank you, Dr. Rogers. We're almost out of time. Do you have any final words?
Yes. In Dr. Reynolds' words, early detection is key. If you're 50 or older, 45 if you're African American, have a colonoscopy or do a self-check with the Cologuard. Any irregular changes in your bowel movements or bleeding in your bowels, in your bowel movement, please go get checked. Discuss this with your physician. A colonoscopy is the gold standard of taking care of this. This disease is preventable, treatable, and beatable, according to Dr. Reynolds. Risk factors. Come to our office. We can test for this bacteria if you have a previous family history of it, because this bacteria has been shown to take inflamed, irritated bowels and move it to cancerous.
So if there's a family history or this is a concern for you, call our office at 570-253-5000 to schedule your comprehensive dental evaluation today. When we come back, we will be interviewing Dr. Charles Whitney to discuss his findings for our Complete Health Butterfly, Christine Lewis.
Complete Health Dentistry.
Healthy teeth and gums for a lifetime? How important is it? At Complete Health Dentistry of Northeastern Pennsylvania, that is our focus. If your mouth isn't healthy, your body can be affected as well. Gum disease has been linked to heart attacks, strokes, and diabetes. And if your teeth and gums are in bad shape, it affects your ability to smile, eat, and live life to the fullest. You've worked hard. Isn't it time to take care of yourself? Turn to Dr. Michael Rogers at Complete Health Dentistry, where you and your health are our number one focus. Take time for your health. Call Complete Health Dentistry at 253-5000 and schedule your new patient experience today. See how we can help you feel and look better than you ever thought possible.
Complete Health Dentistry. Transforming your health for a lifetime.
Visit us on the web at Complete Health Dentistry of NEPA.com.
We've invited our medical advisor, Dr. Chip Whitney of Revolutionary Health Services, on our show today to give us an update on his part in our Complete Health Butterflies transformation. Good morning and welcome, Dr. Whitney.
Good morning, April, and good morning, Dr. Rogers. It's
Good morning,
to talk
Chip.
to you both.
So you met with Christine Lewis yesterday to go over your findings. Can you discuss your findings and your plan in her transformation?
Certainly. So we had a great meeting. She's a very motivated person who has learned a good amount on her own, and we were able to kind of deepen that learning for her. So it was a very interesting case, and it's a perfect example for a lot of people of where we can utilize the technology of genetics that we have. I mean, people have heard of 23andMe for your heritage, but they've got a health version also that you can learn a little bit about genetics, and Christine's a perfect example of why genetics can be valuable. So genetics are basically, people may have heard of genes, chromosomes. Basically, we get one gene from mom, one gene from dad. We're born with it, we're going to die with it, and it's always going to be there and we can't change it. But the thing that a lot of people don't know is that we can actually change the activity of those genes. We have good genes that we want nice and active, and typically are active in young people, and we want to keep them active our whole life, but unfortunately in a lot of people they turn off as we get older. Other genes, I'll call them bad genes, they're quiet when we're young, but they turn on as we get older and get active, and we don't want that to happen. That's a big part of aging on a genetic level. So what I always do in all of my patients is I check one specifically called ApoE. It's just, don't worry about that name, but it's ApoE gene that is a common one, and it really helps to risk stratify someone for Alzheimer's disease, because now we know that there are ways that we can dramatically alter a person's course for developing Alzheimer's disease. Even some early returns that in people with the disease, we might actually improve them some. So I do that on everybody because the younger we start, the better.
And how do you test for that, Chip?
It's a blood test. Sometimes you can do it with saliva, but it is actually one of the blood tests or the test that people do in 23andMe, the genetic testing that you can get for heritage, but also for health. But it's a common one. We've looked at it for many years, but now we're able to utilize it more effectively because we can actually do something about it.
Now, if you do that 23andMe, is that a great way to start and then bring those results to your physician? Or is it something that, hey, I've got this result, now I've got to find someone to help me to interpret it?
Starting with their own physician is a great place to start, and they're going to find a lot of physicians are very in tune to what to do about genetic findings, and others may not know so much. So they don't go in with any expectations, because they may be disappointed if their physician isn't up to date on a lot of that, which many are not. So, and yes, this is one of many genes. I honestly don't know what others are offered on 23andMe, but this is one of them. So the concept of this specific one is that with every genetic test, you're going to see some combination of numbers or letters. And in this case, that everybody's going to have some combination of a 2, 3, or 4. And 2 is what you'd prefer to have. Not very many people have a 2. Most people have 3s. And about 25% of the population has 1 or 2 copies of a 4. So 1 in 4 people have that. So it's not unusual at all to have a 4. What's a lot more unusual is to have 2 copies of the 4. Only about 1 or 2% of the population, so 1 or 2 out of 100 people, have a double copy of the 4.
And when you say 2 copies, that means from mom and dad, correct?
Exactly. 1 from mom, 1 from dad. So in Christine's case, that neither of her parents had Alzheimer's disease, because both of them passed away young, unfortunately, so she didn't have a family history to go off of regarding that, because it doesn't typically happen that young, at which they passed away. Well, what we found on her was that she had 2 copies of that 4, meaning that she has, translating, that means if the average American has a 1 in 7 lifetime risk of Alzheimer's disease, so across the board everybody's 1 in 7, 14%, that Christine has a 50 to 90% lifetime risk of Alzheimer's disease.
Wow.
So
Wow.
it's a big risk. So, and as I told Christine at the beginning of our conversation, that's a disappointing information. But the great news is that we can alter her course. She's still young. She's got a lot of life ahead of her, and this is the exact time to begin to do the assessment to find out what are those, what I like to call leaky holes in the roof. What are the, with Alzheimer's disease, pills aren't going to work. Because they treat one little component of it. It really takes a comprehensive lifestyle approach to prevent and reverse Alzheimer's, and that's exactly what this program is all about.
That's huge.
Now, Chip, in her particular case, are there other factors that we need to contribute or worry about with this, or are there things that are positive that came out of yesterday's meeting?
Well, the approach, so the first piece of information is this person's at risk. If a person has 1 or 2 copies of that 2 I mentioned, they've actually got a reduced risk. They've only got a 5% lifetime risk. The average person is 15%. So what we do if we find someone at risk like her is that we can assess symptoms. If it's an older person, we'll kind of see where they are symptoms. But what we have to do is we have to find out what factors that eventually lead to Alzheimer's disease. It's not one thing. They estimate that it's 50 to 100 different factors feed into the ultimate development of Alzheimer's disease. And what our goal is to identify as many as we can that she might have risks of problems that lead to Alzheimer's disease, and identify and address those problems. So I'll start off by saying that I gave her a piece of information that was good news, in that she actually had on one test, a very important test for her, the best number I've ever seen in an adult. And I've been doing this a long time, and she basically has no hint of prediabetes or diabetes right now. And
Well,
that's huge, because that's arguably the most significant risk factor for Alzheimer's disease, that she's already checked that box, that we don't have to address that dramatically because she's doing really well on that one. So that was exciting news for her, because that's an important component of it. So just without taking a long time to unwrap it, we did find some issues going on that she can address that will, I totally believe, that are going to reduce her risk of having problems, and that 80th birthday can be the 80th birthday she imagines today, that she unequivocally was not on the path to having an 80th birthday that was going to be healthy and happy. But I believe that with some of the interventions we're talking about, and that she'll do over the course of days, weeks, and years, she'll reduce her risk, and she can have that birthday that she'd like to have.
That's awesome. That's awesome. Can we go into some of the details of that?
Sure. So, interestingly, and not just because you're a dentist and this is a dental, you're the foundation of this, that interestingly, her most significant low-hanging fruit of all of the things that we found lied in her mouth, which is, I thought of a fun, ironic twist to this. So what we found was that, well, you already had discovered that she had some gum disease, and she had infections in her mouth that lead to the gum disease. And one of the tests that we did was a saliva test, or you did, it was a saliva test that identified what bacteria in her mouth. Well, we found 2 bacteria that are very, very closely linked to Alzheimer's disease. They've literally found these bacteria in the brains of Alzheimer's patients. We found them at very high levels in Christine's mouth. So if we can eliminate those 2 to 3 bacteria that are strong players, she eliminates that. That right alone is going to help her dramatically, because what ends up happening is those bacteria make their way from the mouth into the bloodstream, cross the blood-brain barrier, set up shop in the brain, and drive the inflammation that leads to Alzheimer's disease. So just that alone will give her a chance of a better future.
Mm-hmm.
So that was the main one, and then there were some other things. We found some nutrients. She'd had a surgery in the past that put her at risk of having some nutrient deficiencies. So we were able to find some things like vitamin B12 was low, homocysteine was elevated, vitamin D was a little low, a handful of others. That we found out that between nutrients and some hormone deficiencies, that we have some opportunity to, through nutrition, working with our gynecologist, that we're able to get her hormone levels where they need to be, get her nutrient levels need to be, because a way to prevent Alzheimer's disease is to feed the brain food, I like to call it, the nutrients and the hormones it needs to grow healthy, plump, juicy, healthy neurons that lead to great memory. So it's when we're deficient in those nutrients and hormones that we have a problem developing good neurons and replacing the ones that need to be replaced.
Okay, so some great news that our blood work came back great for diabetes and worry of heart disease and cardiovascular issues. Not so great on the fact that she's predisposed significantly for Alzheimer's, but we can in essence reprogram her DNA to a certain extent and get her on a healthy path that she could have a clear brain for the rest of her life instead of falling into the trap of Alzheimer's in the future.
Absolutely. So the concept of this ApoE gene is that it makes a person way more prone to the effects of inflammation, so that it's almost like dumping gasoline on a fire when her brain and body are more apt to inflame than the average person. And by these things, and then it's too much for them. But I mentioned the book. I mentioned in one of our other shows that we did the book End of Alzheimer's, that it talks about a series of things, and there's even actually an online support site that I gave Christine for people who have this genetic type of what they can do in order to reduce their risk of problems and create a healthy future. But yeah, there's just this whole series of lifestyle interventions that we're going to be working on with her over the next few months to really set her up for success for her future.
Chip, we're almost out of time. Is there anything else that you'd like to add today?
I guess the only thing was that one of the things that stuck out to me in looking at Christine's number is that if the typical doctor will order a metabolic panel, cholesterol panel, glucose screening, and maybe a thyroid test, and maybe a vitamin D. Interestingly, those core numbers, they weren't perfect, but her blood sugar was great, her cholesterol was great, all those standard tests that doctors utilize were actually looked pretty good, and her doctor probably would have said, you're doing great. It was the things that were off were these newer breakthroughs in science that we've discovered that really have not become mainstream, because unfortunately medicine, what we do in medicine generally takes about 10 to 20 years of science. It takes time to become mainstream, and a lot of these things that we're talking about haven't totally become mainstream, although the scientific support is great, and it just really proves what I always talk to patients about, that yes, we need to found everything we do on great science, but we also have to kind of look at risk-benefit and say, you know what, we got to look at these scientific breakthroughs that are low risk, like physicians talking to dentists about oral health. There's like no risk to that one, but it could have a huge impact on their health. So in Christine's case, most doctors would have said, you're doing really well, and she wouldn't have had any idea. I mean, good, strong, solid doctors would have, in a well-meaning way, said you're doing pretty well, not knowing she's got these engines of disease brewing beneath the surface, setting her up for a future that would be not the one that she wants to have.
Awesome.
Now, Chip, if any of our listeners out there are interested in what you do, can you just give them the best way to contact you?
Sure. Yeah, my website, if they want to learn more about what I do, and I'm actually going to be launching this dementia program kind of middle part of the year, so it's not on the website yet, but the concepts are. The website's www.RHS, that's Revolutionary Health Services, the practice, RHSLiveWell.com. And there's a contact me through the website, but basically that's what we do. We coach people and mentor people into stepping into that future that they want to have, that unfortunately far too few people attain.
Thank you so much for joining us, Chip. You've been listening to Complete Health with Dr. Mike Rogers. The days are getting longer, the snow is finally melting, and now it's time for a good spring cleaning. At Complete Health Dentistry of Northeastern PA, Dr. Rogers reminds you that a professional dental cleaning is imperative to your overall health. Did you know that 8 out of 10 people have gum disease? 50% of all heart attacks are linked to gum disease, as well as stroke, diabetes, Alzheimer's, pancreatic cancer, arthritis, and pregnancy complications. At Complete Health Dentistry, you will receive many life-saving screenings to keep you in tip-top shape and decrease these potential medical complications. We want our patients to enjoy a long, healthy life with minimal medical issues. Regular dental visits will help you maintain healthy teeth and gums and help prevent serious health conditions. Take time for your health. Call 253-5000 and schedule your spring cleaning today.
Complete Health Dentistry. Transforming your health for a lifetime.
We're back with an update on the winner of our Complete Health Transformation Contest. Dr. Rogers, the frightening and exciting part of this transformation is one and the same. We now know that Christine has the ApoE44 gene. How does her oral health contribute to her overall health and this genetic finding?
Well, as Dr. Whitney was talking about, inflammation and infection anywhere in our body can contribute or make the ApoE44 gene signal or make it worse and show up. And so in her mouth, she had significant tooth infections and a lot of gum infections and inflammation. And so our progress here is going to be to address those infections and inflammation.
Can you tell our listeners what have you done for her this week?
Well, this week we met with Christine. We took care of some teeth that were abscessed by doing root canal therapy on them. We took care of some fillings to prevent those cavities from turning into bigger problems.
So she had decay.
Yes. And then we also started to address her gum infections and the inflammation associated with her periodontal disease.
Okay. And what are your recommendations for her at home?
Well, our recommendations for home is good, proper maintenance and home care. We gave her instructions and techniques on how to address this. I'm going to step back 1 second and go into how we found all of this and what's going on. As Dr. Whitney discussed and as Dr. Reynolds discussed, genetics plays a big part in all these diseases. And what we found is in Christine's case, she's got bacteria in her mouth, 3 different types that are driving her towards or driving towards Alzheimer's. She also has that FM bacteria, Fusobacteria nucleatum, which drives towards colorectal issues. We can't be sure because we haven't tested for colorectal issues. But once again, these are just signs how medicine and dentistry can all work together and help our patients live a longer, healthier life. What we need to do now is take this knowledge and change her mindset and her lifestyle, giving her the tools, the antibacterial solutions that we use, the techniques that we use, and the home care techniques that we give her to really eliminate the bacteria so that now the inflammation and the infections in her mouth either won't come back or won't resurface these bacteria and allow them to contribute to disease later on.
So I know that she saw you to take care of the tooth infections. What did she have done to take care of or start the work with the gum infection?
Well, we start off in our first appointment getting the gums healthy, irrigating out the gums, removing all the heavy debris and tartar that's below and above the gum line. In essence, we start getting the gums to respond in a positive fashion. We call it adaptive periodontal therapy, which is a series of multiple visits that Christine is going to go through in our office, non-surgical visits, to decrease and eliminate all this bacteria and tartar and plaque in her mouth.
So like we discussed earlier in the show, a cleaning, just a traditional cleaning cannot take care of this bacteria and infection.
Correct. And once again, if we don't go the extra step, if we just look at the gums, we look at the patient's mouth and just clean away without knowing what's below the gum line, the bacteria that we're fighting and what we need to address, there's no way to help Christine long term.
Thank you, Dr. Rogers. You have been listening to Complete Health with Dr. Rogers. Join us each week as we put the pieces together, explaining the mouth-body connection to your overall health.
Complete Health Dentistry. Transform